Hi, I'm Raksha Suman. Today, I'll be discussing a very important topic lung disease. Lung related diseases are a serious issue in India, affecting all sections of society and all ages. Asthma alone impacts over 34 million people in India, making up 13% of global cases. Lung diseases impact the airways, lung tissues, or the blood vessels within the lungs. These diseases can range from mild to severe. When the lungs are not functioning properly, it leads to breathing difficulties, reduced oxygen levels, and overall poor health. Let's explore some of the most common lung diseases. Asthma, when the airways become inflamed, swollen, and narrow, making breathing hard. Chronic obstructive pulmonary disease, COPD, a group of lung conditions including emphysema and chronic bronchitis that cause airflow blockage and breathing-related problems. Bronchitis is an inflammation of the bronchial tubes, which can be acute or chronic. Pneumonia, an infection that inflames the air sacs in one or both lungs, which may fill with fluid or pus. It is commonly bacterial. Tuberculosis, TB, a contagious bacterial infection that affects the lungs and spreads through the air when an infected person coughs or sneezes. Lung cancer, uncontrolled growth of abnormal cells in the lungs that form tumors and interfere with normal lung function. Lung diseases can arise from various causes, including infection caused by bacteria, viruses, or fungi. Long-term exposure to harmful substances such as tobacco smoke, air pollution, or industrial chemicals. Genetics, autoimmune conditions. Symptoms of lung diseases vary based on the specific condition and its cause. These symptoms may appear suddenly or develop slowly over time. They can also come and go or change. Common symptoms of lung diseases include wheezing, breathing difficulties, chronic cough, lung infections, weight loss, lack of energy, and chest tightness. Complications can be severe, leading to respiratory failure, chronic infections, heart issues, and reduced oxygen levels. These complications can greatly diminish the quality of life and may be life-threatening, especially for infants, children, and adults over 65. If you experience any symptoms mentioned earlier, please visit a doctor. For further diagnosis, your doctor or specialist, pulmonologist, typically performs a series of steps and tests to evaluate lung function and identify any abnormalities. Treatment varies depending on the type and severity of the condition, but common approaches include medications to manage symptoms and address underlying causes, inhalation therapy with inhalers or nebulizers for direct lung treatment, oxygen therapy for those with low blood oxygen levels. Pulmonary rehabilitation programs combine exercise and education to improve lung function. In severe cases, surgery might be necessary, along with managing potential complications. Prevention is key. Here are some tips. Avoid smoking and exposure to secondhand smoke. Reduce contact with air pollutants, dust, and chemicals. Wear protective gear when needed. Practice regular hand washing and limit contact with infected individuals. Stay up to date with vaccines for flu and pneumonia. Lead a healthy lifestyle and get regular checkups to monitor lung health. This message was brought to you by Patients for Patient Safety Foundation. Thanks for watching, and please share as widely as possible.